In the early stages of pregnancy, it's not easy to identify whether vaginal bleeding is caused by a miscarriage or normal menstruation. That's why in this AllForBabies video, we will talk about the symptoms of a miscarriage to differentiate it from your period. Additionally, we explain what happens afterward and the possible causes. Symptoms of a miscarriage. To begin with, pelvic pain is very intense and increases over time. Initially, bleeding is brown, then changes to pink, and finally to bright red. Furthermore, it is very heavy, exceeding underwear capacity, and sanitary napkins cannot contain it. Clots and tissue remnants are also visible, and it may even be possible to identify the amniotic sac. Additionally, fever may occur, which is related to the inflammatory process occurring in the uterus. The duration of these symptoms can last for several days. How to differentiate it from menstruation? How can you tell if it's a miscarriage or your period? To learn how to differentiate them, let's look at the symptoms of menstruation. Pelvic pain is usually not as intense and can be tolerated and relieved with pain relievers. Moreover, the color of the bleeding starts as brown and later changes to red, similar to previous menstruations. On the other hand, the amount of bleeding is not as abundant. Sanitary napkins can absorb the amount that is discharged. If clots are observed, they are small and without maternal tissue remnants. Fever does not occur, and these symptoms last a maximum of 3 days. What happens after a miscarriage? Once the symptoms are identified, if it is a miscarriage, many emotions and doubts arise in some women due to the type of process they have gone through. Some of the consequences of having a miscarriage include loss of pregnancy symptoms, back pain, fatigue, abdominal cramps, episodes of anxiety, difficulty sleeping, weakness, sadness and crying. How long does bleeding last after a miscarriage? If you have experienced a miscarriage, your body will need a period to return to normal, although it depends on the weeks of pregnancy that have passed so far. The bleeding that occurs is minimal, appears in moderate amounts, and then only spots are observed. Discomfort in the pelvic area is also common. Since the miscarriage occurs in the early weeks of gestation, it can last between 2 to 4 days, and recovery is quite rapid and satisfactory. In exceptional cases, if the pain is very severe and bleeding is heavy, emergency medical attention will be required. Menstruation returns to normal within 4 to 6 weeks. It is important to avoid sexual intercourse and physical exertion for at least a month after a miscarriage to allow the body to recover. Methods to identify the causes of a miscarriage. Before attempting to get pregnant again, it is important to verify with your healthcare professional that your body is in good condition. There are useful methods that can provide insights into the causes of a miscarriage. First, there is transvaginal ultrasound, which is a very useful examination because it shows the inside of the uterus and allows visualization of other structures in the female reproductive system, such as the fallopian tubes and ovaries. If there are any problems or abnormalities in these organs, such as a miscarriage or an ectopic pregnancy, among others, they can be identified in time. On the other hand, there is blood analysis with a focus on hormones. This test can identify if the causes of the miscarriage are due to alterations in female hormone levels, which are essential for a successful pregnancy. Finally, chromosome analysis can be performed. These are done using blood or tissue samples to identify abnormalities in maternal genes. If you have any doubts, it is important that if you notice any alarming symptoms that suggest you are having a miscarriage, you should seek immediate medical attention. Your healthcare provider can confirm, through specific tests, the process you are going through. See you in the next AllForBabies video.